Happy to have you with us.
Thank you so much, Olive.
And thank you for speaking to us and sharing your experience with COVID-19. You recently tweeted something quite lengthy on your experience with COVID-19. You're looking well. Are you feeling well?
Well, I can say largely I'm feeling well, but again, I can't say I'm 100%. Yeah, because even after having been discharged from hospital in about over 30 days, there's still what I would call residual symptoms and effect of the pandemic on me, or the disease, because I still suffer from episodes of breathlessness, but also I'm unable to smell as of now, and neither am I able to taste anything. So I can't tell that I can only tell that I'm eating this kind of food by looking at it, but I cannot tell by, getting the taste in my mouth.
Nothing at all? Not cardboard tasting or anything?
Like, you can imagine like somebody who is eating sand. Yes, that is what it feels like, honestly. And it is like what experts say, that it may take a while, and there is no medication to be given for that. So the body system will have to readjust until it gets back to where it was before. And you cannot rush it. It's something that you just have to give it time for it to get back to what it was. But that is what I am right now.
Was this the most physically excruciating experience of your life? Because you were in the military.
Yes,
so I would imagine you're used to hardship.
Well, hardship is different from pain. Honestly, I've been to Somalia, and I have even been admitted before for other things, operation and stuff like that. But I must say that this was the most trying experience or trying moment for me, having been, in Somalia, surrounded by Al-Shabaab, but this was the most trying. Never been, and from I think from a young person up to now, I think this is the longest time I have been in hospital. Cumulatively, having been admitted before, but even if they were to be added together, they cannot amount to 30 days. This is the first time ever in my life that I have been admitted for around 30 days.
So it was physically grueling?
It was. Maybe what I did not write, like again, when you're writing, you cannot write so much. But when I went to hospital, I was 92 kilos. But within a span of a week and a half, I was 82 kilos. So that can tell you the amount of shock the body, had been subjected to.
So on COVID-19, the first case was reported in Kenya. You were right there. The briefings that are given daily by the government, you were right there. Did you ever suspect that you'd be among those in that number?
I was always aware that, I was among the frontliners, as a frontliner, you're always, at risk of contracting this disease. Of course, you even gone to some hospitals where, COVID patients are actually being managed. But even as we're going there, we always, ensured that those containment measures were able to abide by them. There was no one time we've gone without a face mask. There was no place we've gone and, we don't sanitize where possible, or don't wash our hands and maintain social distancing. So I think the next question would be then, how did I contract this? If I can see the line of questioning. I can't tell how I contracted this or where I contracted it from. Because I tell you this much, my life within that period has been very mechanical. Mechanical in the sense that, my movement from home was in a form of a pattern. That I come from home, I get to my office at Ministry of ICT up till about maybe 11, 12 midday. Then I go to Ministry of Health. We do the statement, we finish the statement, then we do the press conference, then I get back to MICT. From there, I go home. That has been the pattern for over 4 months. So there was no deviation within those 4 months. So where I contracted this, a virus, I have got no clue. I don't even want to think about it because it will bother me for no reason. I can't tell. Even the people that I shared the vehicle with many times, they're all negative. My office colleagues.
And you found this out after they traced the people you've been in contact with?
When I was tested and I came negative, I called them, those that I was able to reach. Hey, I was tested and I am positive, please go for testing. So they went for testing, those that I was able to reach, and all of them were negative, including the, and I'm talking about, a vehicle is a very confined space, that if one is infected, the possibility or the likelihood of others, and most of the times we're riding 4 people in a vehicle, you'd expect the other 3, at least 1 or 2, to be infected. All the 3 of them were negative, including the people that I work with closely in the office. All of them were negative. So it baffles me how I contracted this virus.
On July the 19th, you released a statement denying that you had taken ill. There had been some suspicion at that time that you had been taken ill, and you said, I'm well, I'm not admitted in hospital. And then a few days later, you tell us you have COVID-19. What transpired there?
When I released that tweet, I had not gotten my results, though I had already been tested. So I could not come out and say that I am positive without getting the test results. Then I would have been giving out information that is not accurate. So when I eventually got the test results, I did not release it the very next day. I have to, think about the implications. I released it like about 2 days that yes, I was tested and the results are negative and this is what is happening to me. So that is, that time lag was based on that.
Okay. Yes. Do you think it's perhaps a bit unfair that as a public figure, people expect to know your status?
Yeah, but of course I did give out my status.
No, I'm saying, but do you find it unfair, that undue interest?
I mean, yes, I don't think there is any undue interest there. Of course, some things are a bit personal, but looking at the kind of society that we are in today, and being a public, not just figure, but being somebody who is paid by the taxpayers' money, they need to know your health. I think that they have every reason to know your health. Yeah, but of course there are things that you cannot ask, then why did you not tell us at this time? The fact is that it was eventually told to you, So with regard to whether they need to know, I think at certain level they need to know, because again, you are serving them. So they also need to know about your health status.
Okay. All right. Are there moments that will stay with you? There are certain moments that you captured in your tweets, but again, like you said, you couldn't tweet everything. What are some of the moments you don't think you'll ever forget?
I think there are 2 moments. The first one that I will never forget is when I was unable to get from the washroom. And when you're there, you're wondering, really, should I shout? And you can't shout because if no voice or no sound can come out. You can only, like we are now talking, because we have got air in our chest or in our lungs right now. But when there is no air in your lungs and your lungs have been completely inflamed and compromised and no air can get in, no sound will come out. I can't forget that.
Were you on the toilet seat?
No. I had come out and I was actually just about to get out of the,
the washroom?
The washroom. And then I just lost all the energy that I'd been able to put together. So I didn't know how long I was going to sit there, yet I don't have the oxygen mask on. I don't have any cylinder with me. Not because cylinder was not there, and I have to make this clear so that it can also go up. I was offered a portable oxygen cylinder, but I declined to carry it with me. I was also offered a motorized wheelchair, but also declined to be ridden on that. So I had to struggle myself, despite of the pain, despite of the difficulty, to exercise myself, to try and get psychological resilience that I can be able to reach there.
That's one.
Yeah, that is one. The second one, because of the struggle and the pain to get out of bed, there are things you don't want even to happen to you. You don't want to feel pressed because of what it will take to get to the washroom. I know some people may want to ask, then what about a potty? Or a catheter? I didn't want any of that. And trust me, I was offered that and I said no. Let me fight. Let me struggle.
So that moment in bed,
So
what
that
is it
moment,
about it?
you know, that moment in bed, you are looking up and you hear, you know, I'm hearing, I'm sorry, I'm seeing, you know, things like fans, you know, on the roof, you know, like dark fans. And if you look carefully, then they disappear. So it's like this, something you're imagining was going on in your mind that you can't quite place, you know, and have an explanation for. And then as I'm doing that, remember that time the eyes are closed, and when I open up, I can't see nothing. You hear some sound, like some voice or some people talking in the but you can't quite tell what is being said. You understand? So it's like you're hearing noises, like, but you can't quite tell what are these, you know, who is saying this, or where is it coming from? But it is in the head. You understand? So it's an incomprehensible kind of voice that, or sound that you hear, but you can't quite decipher them. You know, that to me was, and that's what I'm saying, that at that point I was not sure whether I was really alive or dead. You understand? Because it's like I was losing my mind or something. You understand? That was quite, you know, something that, you know, worried me also. And that's what I'm saying, that I convinced myself that if I have to die, let me die trying to stay alive. Yes. That is something that is going to be with me for some time. Yeah.
And that's not something easy to talk about, because if you didn't tell us, we wouldn't have known. Do you feel exposed, perhaps? Do you feel vulnerable revealing these things?
No, I do not feel vulnerable. Honestly, I feel that from my experience, people can be able to learn and understand that this disease is not a joke. It takes, you know, boldness for other people to learn from you, because you can't tell how it will manifest in you should you contract it.
What do you say then to those who are disbelievers? I remember when we had patient 1 and 2, a healthy speak to people after they recovered, that those who are like, that's a PR exercise. How do they know this is not a PR exercise?
I have got nothing that I want to achieve from this. I already have my reputation as a soldier, which was enough reputation. I do not want anything more than that. But I'm doing this so that my brothers and sisters who have not been able to go through that experience, they can get to learn that this is a very, very serious disease. Honestly, like I did mention, that when I went there, I was walking, very well aware that if I have to be here, I'll probably be here for 10 days. At the more, I even carried 3 books. I did not get to read beyond one introduction of the 3 books. Because even to read requires energy. To concentrate requires energy. And when you don't have it, even reading is a serious undertaking. Olive, I was able to brush my teeth after about 14 days. And I tell you why. Even standing to brush takes time. And to take time, you're using energy. You're using oxygen. When you don't have oxygen, you can't stand for even 30 seconds. So I have got no reason to come out here and play PR. For what benefit? For what benefit?
What were you thinking about, not sure about tomorrow? What went through your mind? Were there any regrets?
I remember, you know, giving instructions that please, you know, I have a daughter here, you know, for my madam to tell her everything, so that even in case of my absence, she is able to know where everything else is. So yes, there is a sense in which you want to prepare your place before you go. That is one. But there's a sense in which you feel that if it has to come, let it come. Because you can't stop it from coming. But again, you didn't want it to come. So you're saying, I have got this family, a young family, that needs me, I must stay alive. So really, it is not something that you can say your mind is totally blank, but you're thinking about so many things at the same time. And the number one thing that to think about, and that would apply for anyone, is your family.
So has it changed your outlook on life?
It has, and let me tell you what, perhaps not even that, but the day I stepped out of the world like this, I only realized how important it is to be out there. Really, that you're able to breathe fresh air again, you're able to interact with nature again, you're seeing people moving around, not in PPEs, but in normal, ordinary clothing. So that aspect of human intervention in this, maybe not physically, but through prayers, I felt was also very, very important. So there's a sense in which I now look at, human interaction in different level, and also that I also did write that prayer pays, and prayer works. Perhaps before then, I'm a Christian, yes, but that appreciation, because sometimes we can be the same age, suffering the same condition, we are given the same medication, but one will succumb, another one will live. You understand? Then what determines that? Yet you're being treated by the same doctors. So sometimes there is something beyond the doctors. And I think myself, it is that extra hand that, decided that you are going to go back, and on this day you're going to talk to Olive Barrow of NTV, you're going to talk to the Republic about your situation.
You're looking at things now from new eyes, yes, a new perspective, having been on the other side, so to speak. I know in your tweets you talked about being in the eye of the sniper. How has it changed your perspective as about how we're managing COVID-19 as a country?
I think as a person we have done extremely well. And I'm not saying this as PR because I work for the government. I'm saying this because I have been there and I've seen what we have done as a country in terms of the measures that we're able to put. But certainly there is a lot more that we can still need to do, because there is always room for improvement. And there are certain areas that we may perhaps improve, not because we're not doing well, but because we can only we perhaps take them to another higher level in order to provide our people even more care. And I tell you one, I was in hospital for about 29 days. And I was on continuous and sustained oxygen supplementation from day 2 to the last day. And it was only when I was getting out of the room that I was not having it. Assuming that I was in another hospital where oxygen is competed for. Today you have it, or this hour you have it, another hour it is with another patient, maybe it is not there, the suppliers have not brought it in, I don't think I would be here. So my point is this, that if we can be able, as a government, to ensure that all hospitals that manage COVID all have got piped oxygen, that they can be able, when admitted, to have continuous supply of oxygen throughout until they recover. I think that would be something that would help us to be able to not turn this thing around, but to be able to manage those who have been infected and require oxygens, supplementation or all the time, much, much better. That is one. But number two, again, this is not government. This is us as a people. In this sense, the government will not come to you, Olive, and tell you that you must wear this face mask. The government will not come to you and tell you that you must be able to maintain the 1.5 meter social distance, because that information we have given out, the government has given out, and we are all rational and we are all sane people. We can understand and interpret these simple instructions. So we must ask ourselves as a people, what is our responsibility in this?
So, having experienced what you experienced, the worst of COVID-19, or close to possibly the worst that people experience when they get infected, what do you feel when you hear reports that the monies that were allocated to COVID-19 may have, and I'm not saying it has been done, but having been there, what does it make you feel when you hear reports that perhaps some of these monies were not used as they were for what they were meant for?
You know, it may be unfair and also not appropriate, perhaps also irresponsible, for that money for anyone. Anyone. And I'm not saying that this applies to our country. I'm talking about anyone, it be in country A or country B, to divert that money for any other use, right? However, coming to our own country, whatever you mentioned, I have heard it even myself, and I'm glad that the head of state himself did mention, even did put together, you know, a team, or directed the various investigative agencies to be able to investigate that case and give a report within 21 days. And we can only hope that whatever, you know, allegations that are there will eventually be found not to be true. But if they are found to be true, then certainly I trust that the government will, even the president himself, will determine what course of action to be taken.
So what's the toughest thing about your job? The thing you just hate to do?
You know, I am a soldier, and I will always be a soldier. And there's nothing a soldier will say is tough, really. It's a job that has to be done, honestly, and you know, I think I enjoy my job, largely. I do enjoy my job, and I'm not, like I would say, I'm not saying this as PR. I like my job. And trust me, the experience from the military has also helped me to do this job, in this sense that because it is not an 8 to 5 job, the military call is not an 8 to 5 job. Communication is throughout. So for me, it is always work every time. No Saturday, no Sunday. I'm always at work. In the same case, I was in the military. So I would say that...
but that can't be easy in itself.
If I wasn't a soldier before, it would be very difficult. But it's something that I've done for about 30 years in the military, so I don't find anything new in that. I don't find anything strange in that. I think I would be more bored if I would be working from 8 to 5.
Have you ever Googled yourself?
I believe that I haven't really looked a lot about what people talk about me out there. But I've had people talk out there about me.
So you've never been curious and typed in retired Colonel Cyrus Oguna?
I know there'll be many pictures, there's many things, but I haven't necessarily taken time because it's just me.
Okay, so what's the strangest thing that has ever crossed your inbox about yourself?
I think there was something about me when I was in Likoni. That was last year around August, and I think it was your station, maybe not you exactly, but Nation, you know, it was one of the Nation newspapers that, you know, they came up with a cartoon about me, and like what I was saying was nothing but, you know, like, you know, several Z, like you're not saying anything that is comprehensible. That I found out there, and, you know, to anybody it would worry someone that how you're trying to do the much you can, but what is coming out is that what you're saying is not something that, you know, people find sense in. You know, when I look at it the other way, is that whoever is doing that must have paid attention for him to come up with that. So really, you know, maybe that's what I saw, and honestly, I don't Google as much about myself, because again, the reality is this. This is an open space, this is an open country. There are those who will say A, there are those who will say B, and if you're going to worry about what people say, you're not going to do your work. So me, I do my work, and I let everything else to God.
But it did hurt your feelings?
No, it did not. I can tell you that much fact. It did not. It never. And again, I'm saying this is me. It is me. I think perhaps maybe one of the things that I can say that God gave me as a quality and a strength is that there are things that really never hurt me, really. you know, because if you're going to get worried about other people think about you, even others who do not know you, then you not do your job. So you do your job to the best of your ability. Those who have got other opinions, other feelings, other thoughts about you, it is up to them. Okay, but do your job to the best of your ability.
Okay.
Yes.
Should I call you a master of crisis communication? I mean, you've brought up Likoni, Corona, even KDF when Kenya first set boots in Somalia.
Let me tell you, I don't think I'm a master of crisis communication, but one thing I know for a fact is that everybody wants hope. Especially during crisis, all of us want to be given hope, right? So, and everybody wants to be appreciated. So if you can be able to, and I think that is something that I perhaps maybe one of the strengths that I could be having, but I have, you know, perhaps from the military background, every soldier in the military, whatever little they do, even if they make mistake, first of all, you must appreciate the effort that they have put to make that mistake. You know, so we were taught in the military that never be shy to appreciate something. Never be shy to say thank you. Never be shy to say well done. Never be, even if it is your enemy. That is one thing we did in the military. And in the military, if you're not going to raise hope to your soldiers, then you don't have a force.
Well, we're happy to see you in good health and recovering nicely. And I want to say thank you very much for granting us the opportunity to speak to you and for sharing your experience with us. Colonel, is that how you salute?
Yes, yes, that is how.
Thank you
but I'm
very
retired
much.
now.
Oh, okay.
Not retired Colonel, but Colonel retired.
All right. Okay.
Why? Because I will always be a Colonel up to the time I am being lowered down. So I will not retire from that rank.
Okay.
I only retired a bit from active service.
Active service. So Colonel retired Cyrus Oguna sharing his experience with COVID-19. Thank you very much.
Thank you so much. Very much appreciated.